right, Dr. Drakeford, are you ready to begin? Perfect. All right, good morning, everyone. My name is Haley Farver, and I am the moderator for this session. So the session that you are currently in is Conducting a Campus Safety Mental Health Needs Assessment, Innovative Strategies to Engage Students of Color. Our speaker today is Dr. Naomi Drakeford. She's a multicultural specialist at the University Health and Counseling Services at Case Western University. All right, I'm going to turn it over to.
Okay, great. Thank you, Haley, and good morning, everyone. Thank you for choosing to attend this session. I hope that it can be engaging and hopefully helpful in terms of thinking about how you can do creative needs assessment strategies with students on your campuses. I'm just going to share my screen real quick. All right, can I get head nods if you can see it okay? All right, perfect. Okay, so as we get started, one of the first things that I want to do is encourage us to keep the goal in mind of this entire conference for today, which is behavioral health equity. That's our goal. The Substance Abuse and Mental Health Services Administration defines behavioral health or mental health equity as the right to access quality health care for all populations, regardless of the individual's race, ethnicity, gender, socioeconomic status, sexual orientation, or geographical location. Equity really addresses the question of, does everyone have a chance to be as healthy as possible? Unfortunately, as we know, in this society, a number of factors can get in the way of making sure that equity is achieved. And so moving towards equity means that we've got to address all the issues that influence someone's care. Things like social determinants of health, culturally informed care, any barriers to seeking care, things like stigma or lack of access, as well as structural inequalities. So I will be covering the following. I'll give you a little bit of an overview of the presentation. I will give a quick overview of the Equity and Mental Health Framework, which is the framework that we've been using at Health and Counseling here at Case Western Reserve to specifically support the mental health of our Black, Indigenous, and people of color students. We will take a look back at summer 2020 and specifically looking at our students' response to injustice, the ways that our students in particular use social media to amplify their voices and experiences. I will explain how I reviewed a social media account organized by our Black students to talk about their experiences at our university. I will review the themes that I identified and then the interventions and action steps that we have done based upon those themes. And then we'll end by strategizing for your individual campuses. So to start, let's take a quick look at the Equity and Mental Health Framework. I'm sure many of you are probably familiar with this, but in case some are not, I will review briefly. So the Equity and Mental Health Framework was published as a collaborative effort between the Steve Fund, which focuses on students of color, and the Jed Foundation. The framework includes 10 recommendations with key implementation strategies, all focused on students of color. So I've listed the recommendations here. You'll see that some of them are noted with an asterisk. Those denote specific recommendations that we are in the progress of actually doing at Case Western Reserve or we have already done. Recommendation number 1 says identify and promote the mental health and well-being of students of color as a campus-wide priority. An example of how we've been doing that at Case Western Reserve was just last month. We did our own College Mental Health Equity Symposium that was open to the campus community as well as community partners, and it was open to students and it was free of charge, and we had a really great turnout. Recommendation number 2, engage students to provide guidance and feedback on matters of student mental health and emotional well-being. You'll hear more about that in just a minute. Actively recruit, train, and retain a diverse and culturally competent faculty and professional staff. Create opportunities to engage around national and international issues and events. An example of that is next Tuesday is the anniversary of George Floyd's murder. And so we are planning different events for students to provide support and acknowledge that anniversary and what the impact may be. Next recommendation, create dedicated roles to support well-being and success for students of color. Support and promote accessible, safe communication with campus administration and an effective response system. offer a range of supportive programs and services in varied formats. You'll hear about that more in details when I get to interventions and action steps. Help students learn about programs and services by advertising, promoting through multiple channels. One of the issues that we have noticed in our department is that we're doing a lot, but sometimes students don't always know the programs and services that we're offering. And so finding new ways like social media, for example, to make sure that students are aware so they can attend the programming that we're offering. Identify and utilize culturally relevant and promising programs and practices and collect data on effectiveness. So a key point of the equity and mental health framework is doing what works. And the only way we're going to know that something works is to actually evaluate it. And then the last recommendation is to participate in resource and information sharing within and between schools. So that's actually part of why I'm presenting to you all today. A big part of the framework is sharing what works, sharing what you're doing with other campuses to spread that knowledge. In addition to the 10 recommendations, the framework is organized into 4 stages. So you start with a needs assessment, specifically looking at your campus community and what do your students of color need, what issues are they facing, what climate may be impacting their experience on your campus. Then move to implementation, so actually doing your programs and interventions. The next stage is, as I was saying before, evaluating it, right? So looking at what works. Are people actually attending? Are you getting the desired outcomes that you were hoping for from your programs and interventions? And then the last stage is dissemination, sharing what you've learned with others. So let's go back to reflecting for a couple of minutes on summer 2020, because this is when our needs assessment planning really started. So if you take yourselves back mentally to last year, particularly in the summer, you might remember that that was at the height of the COVID-19 pandemic. In the middle of shutdowns, things are closed, campuses have not reopened. We were at that time really learning that the pandemic was having a disproportionate impact on people of color. There was a lot of anti-Asian rhetoric and scapegoating that was happening, especially affecting our international students on campuses. There were countless incidents of racial injustice and police brutality. And you might recall, every time you turn on the news, you might have felt like you were hearing about another, particularly Black person, who had been the target of some type of police brutality or excessive force. Breonna Taylor, Ahmaud Arbery, George Floyd, Jacob Blake. It was one after another. And then there were protests erupting across the country, many of which our students were participating in. And some of those protests, as you might remember, turned violent. College students across the country were demanding accountability from universities on multiple issues, and Case Western Reserve was not exempt from this. So students nationally were speaking up about experiences of systemic racism, support or lack thereof for survivors of sexual assault, and really challenging Title IX processes. Students were speaking up about mental health support and resources, what was currently available, what they felt was lacking, what they wanted. They were speaking up about campus climate and how it could be better improved. They were also speaking up about tuition costs and how university funds were being allocated and how students thought they could be allocated better. Of course, all of this, right, summer 2020 was leading up to a contentious presidential election. And then at University Health and Counseling Services here at Case Western Reserve, we were starting our work to implement the equity and mental health framework, right? What good timing to be focusing on students of color and beginning to plan for needs assessment. So actually, my summer project for our department last summer was to look at the equity framework and to begin planning our initial steps. How can we be implementing the framework? What do we want to do first? Particularly thinking about needs assessment. How can we involve students' voices into our process? And I initially thought of some of the usual things that come up when we think about needs assessment. So surveys or focus groups, or I would go to different student organization meetings and ask students about their perception of our services. What was happening at this time was that our Case Western students were really active on social media. And a number of different social media accounts came on the scene at this time. Our students made a Black at CWRU Instagram account. There was a survivors account, particularly focused on sexual assault. There was a disability at CWRU account, LGBTQ. Various student groups were using, particularly Instagram, to speak to their experiences and to call accountability for the university. And it was getting a lot of press. And so I brought up the idea to my executive director of, how about we change it up? Maybe instead of some of those traditional methods, what if my summer project is to look at the Black at CWRU Instagram account and to treat it as a qualitative study? At this point in time, the account had over 2,700 followers. So not only were our Black students speaking and many posts, right, a larger sample than we would get through other traditional methods, and we knew that our campus community was reading it. And so it felt really important to me that as a department, we were also reading and listening to our students as well. And to my surprise, our executive director said, that sounds great, go forward with it. And so that is what I'll be sharing with you today. Our specific posts that our students shared and how I analyzed them. So as I mentioned, many students were posting, but also many students were following these accounts. If you think back to summer 2020, that timeline that I showed just a couple minutes ago, to put it into context, this account was created. It's organized by Black students anonymously, and students can also submit anonymously. And the post started on June 30th, 2020. So it started in the height of all of this racial injustice that was particularly affecting the Black community last summer. It feels really important to me not to paraphrase what our students said, but rather I'm going to be using their direct words. So throughout this presentation, I'll share directly their voices and experiences. Keep in mind that although these posts are going to represent the Black at CWRU Instagram page, sadly, their experiences are not unique. Black students and other students of color across the country have these same experiences of racism. So what I would invite you to do is not to read these posts solely through a lens of Case Western Reserve, but to be thinking about it within the context of your own students, your own campuses, and how their experiences may be similar. I'm going to begin by reading a sampling of these posts, and what I would ask you to do is to pay attention to what feelings and thoughts come up. I'm an African immigrant, and when I told one of my floor mates that I moved to the States when I was young, he said, "I speak good English. I've lived here since I was 2. Again, students submitted anonymously, but they could also put their class year of graduation, and you'll notice that also some alumni posted on this account as well. Last year, I was the only Black girl in my dorm building. I didn't truly think about it until I realized that a few people would give me dirty looks when I passed by them, or just blatantly ignore me when I tried to be friendly. I never heard any blatantly racist comments from anyone, but there was a lot of ignorance that went around. While there were very nice people in that building, it made me feel very out of place. And it got to the point where I was only in my building to sleep, or if I was with a friend. It really sucked feeling rejected by people that I lived with. During orientation week, I got into an elevator in Smith with one of my friends. Another student who lived above us followed us in and tried to make small talk by guessing our names. He correctly remembered my friend's name, but when he couldn't remember mine, I told him my name, and he replied that it was hard for him to remember ghetto names. My freshman year, I was taking Sociology 101, and the topic of discussion was affirmative action. I was one of the few Black people in the class, so it was already kind of an uncomfortable class for me. During discussion, my white male partner turned to me and asked me, "How does it feel to know that you are at Case because of affirmative action?" Not because of my 4.2 GPA I got in high school, not because of my high test scores, and not because of my extracurricular activities. No, it's because of affirmative action. I'm an Asian student, but I've experienced my Black friends being mistreated in class. If they don't get as good grades or perform well or even better than others, they're automatically thought of as unintelligent. You can see the looks from the professors, like, how did you get in? And this is so prevalent in our faculty, and students don't get the respect for the hard work that they deserve. There's absolutely no leniency with anyone struggling with things like mental health, especially POC. It is so obviously biased at CWRU. Feeling like you have to wear case gear 25/8, especially at night, to prove to everyone else you aren't a threat and you belong here. This one time during my freshman year, I overheard a group of guys, mostly white, and they were ranking girls for attractiveness based on skin type. They said it was like a totem pole with black girls at the bottom and white girls at the top. Someone asked about lighter skinned girls, and they said that if the girl was black, she would still be at the bottom because black girls were never attractive. During orientation week, I wasn't wearing my name tag. It was messing up my fit, and I was walking back to my dorm. A white man came up to me and said, "Excuse me, to get back to the neighborhood, we ask that you don't cut through the campus." I told him that I went here, and he started apologizing profusely, but I just left. I was so irritated because it was only my third day at Case, and it had already started. It was during the first month of school. I was already getting a lot of heat for being a humanities major at a predominantly STEM school. In addition, being Black and female did not help. A white male foreman of mine asked me, "How did you get here?" This was just another reminder that no matter how successful you are, there are always others who want to insult your hard work and intelligence. So I want to pause for a moment just to check in. And I'm going to stop sharing so that I can at least see a little bit more faces if people have cameras on. Before reading, I asked you all to pay attention to what feelings or thoughts came up. And I'd like to hear from at least a couple people their initial reactions to these posts. What came up? And feel free to unmute yourself.
I got angry.
Really sad for those students.
Yeah.
As well as angry.
Mm-hmm.
I think for me, it's kind of sad. It's like sad that societally this is very normal for students to experience. I mean, when you think about Facebook, the whole premise of it being created was so that males could rank their classmates on attractiveness. It's like the premise of Facebook. And so when you have that gaining so much popularity and being so celebrated in culture, then it really opens this dialogue among students to be ranking attractiveness and then on top of that, implementing their racist bias into that.
Mm-hmm. Absolutely.
It just makes me think of student affairs theory and like sense of belonging, along with like Tinto and Aston, of like, just from these accounts, these students aren't feeling like they belong because their peers are making them feel that way. Mm-hmm. So that leads to lower retention for students, and there's already a low retention for students of color. So like, how do we as student affairs professionals really create that sense of belonging when their peers aren't doing that?
Yeah, absolutely. And you'll actually see one of the themes that I identified is these constant messages that our Black students receive that they don't belong here. So certainly, particularly us in student affairs, part of our work is figuring out how can we give a counter narrative, right? How can we affirm that our students belong, all of them? I'm seeing that some people had trouble getting in, and so you might be lost. So let me just do a quick catch up of what we're talking about. So as an innovative needs assessment strategy, what I did last summer during the height of racial injustice that was particularly affecting the Black community was to review a social media account that was created anonymously by our Black students at Case Western Reserve. It's called Black at CWRU. Students use this platform to anonymously share their experiences in a residence hall, on campus, in classes with professors, peers, etc. And I treated it as a qualitative study to understand our Black students' experiences, look at their mental health needs, and then we'll move in a couple of minutes to talking about interventions and action steps. So right before people, it looks like we're able to join in. I read a sampling of the post, and there will be more here. So if you're just joining, you'll get to hear directly from our students' experiences as well. And so we were just sharing thoughts and reactions to a sampling of those posts. Does anybody else want to share any thoughts or feelings that came up in response? Go for it.
I was trying. Hi, Naomi. So I think this is maybe the presentation that I heard you give earlier in the month. And I think just with a lot of the comments that you read that students had, the thing that was also really terrible was that how quickly into their education they started. Like that everything was right out of the gates, that this all happened to them. Anyway, that was my takeaway.
Yeah, I don't know if others picked up on that. Like in my first 3 days, the first week of orientation, like think about what's happening during orientation. You are literally just getting your bearings. Where do I go? Who are these people? You're trying to make friends and you're already having these experiences of exclusion and othering occurring. And that's actually one of the themes, Casey, so thanks for pointing that out. All right, we will go back to the slides here. Give me one sec. Okay, thank you so much for those who shared. Okay, so next I'll explain in detail my needs assessment strategy, because again, part of today is really sharing what I did in the hopes that you can think about what may work for your campus and ways you could do something similar. So I did a qualitative analysis of all the Instagram account posts. As just a side note, I did also meet with the student administrator of the account. Again, it was anonymous, so this was a Zoom meeting, no cameras, no name, and was able to hear from this student kind of the background of how this came to be. As well, he also shared all of the posts. So only certain posts actually get posted onto the Instagram page, and he shared the spreadsheet of all submissions, so I was able to not miss anything. All right, so continuing on, I'll explain in detail my assessment strategy. So it started with reviewing and reading all of the posts, just to get a sense of, in general, what our students were sharing. Then I sorted them based on similar content, really considering the direct content. So what was specifically said by our students, things like I was profiled by police, but also thinking about the indirect content. What was the underlying message within the post? For example, they might have received the message of not belonging at Case Western. I also thought about everyone involved in the post. So did the post reference an experience with a peer, a friend, roommate, acquaintance, stranger on the campus, or was it with faculty, staff, or with police? The next step was to identify common themes among the posts, including any sub-themes if necessary. And you'll hear those themes in just a moment. I then categorized all the posts into relevant themes. Some posts do fit into more than one category. And then, being a mental health professional, right, the next step was to think about what are the mental health implications? Again, direct implications as well as indirect. So you'll see as well in a couple minutes that some of the posts directly mentioned how experiences on campus affected mental health. Things like, I've never felt more alone than I did in that moment. Others were more implied. I also want to acknowledge really the personal and professional experience of doing this qualitative analysis. So for those who were here, the first couple of minutes, I shared that this was my idea, right? And I went to my executive director and I posed, how about I do this as a summer project? What I didn't think about was the personal impact that it might feel like for me as a Black woman to also be reading this post in the height of summer 2020, as I'm also ingesting all of the news and being impacted myself. And so this was one of those times where kind of personal and professional really intersect, and it can be challenging that one is going to inform the other. So, professionally, this felt like an obligation. My standpoint is that when students are speaking, we listen, right? And especially when our students of color are speaking, I want to be someone who is listening and paying attention to what they're saying. And so if 2,700 people are following this Instagram account, my opinion is that Health and Counseling Services needs to be one of those followers and listening and watching and reading, and then changing what we do to better support our students. Personally, this was challenging. There were times of, even still, I'll go back and read these posts and I get choked up, right? Of thinking about the impact of these experiences on our students. And then also, particularly as a Black woman, being able to relate, right? So when I hear about these rankings of attractiveness and how Black women are at the bottom, I'm not immune from that. And so one of the things that I just want to bring up is, if you do an analysis like this, to be mindful of who's doing it, what self-care might be needed, what support might be needed for you in the process of doing something like this. It was certainly worth it, and it was challenging at the same time. Okay, so after analyzing the post, I identified 9 themes. The number one, a clear one, especially to begin with, was racial profiling by police and others. This involved things like being followed, being asked for IDs, question about their behavior or identity as a student. Pervasive microaggressions and racism perpetuated by peers, staff, and faculty. Multiple, many settings, many people. Sadly, the third theme was that when racism is reported, nothing happens. So our students spoke to, I experienced this and I made a report. This happened in class and I went to the dean. This happened in my residence hall and I told the residence director, and nothing happened. They never knew the outcome, or there was no consequence. A sub-theme here was a denial of racism. If I go and I talk to someone about it and they say, oh no, I'm sure that that person didn't mean that. No, that's not racist. You're interpreting it the wrong way. Theme number 4, endorsement of stereotypes of Black people by CWRU campus community. Theme number 5, Black women face gendered racism at CWRU. Gendered racism is that oppression that's due to both gender and race. That unique intersection of these identities particularly impacts our Black women students, where they can't necessarily say like, oh, that was racist or that was sexist. It was really both together and uniquely based upon their experiences as Black women. Black students experience microaggressions and racism very early on in their CWRU journeys. So this is the point that Casey was really mentioning. Noticing how in the first 3 days during orientation, you'll hear a couple more examples during move-in of what is the impact of students already having these experiences very early on and just getting adjusted and hopefully finding their sense of community at Case Western Reserve. Theme 7, Black students receive constant messages that they don't belong here. Over and over again, that was something that was mentioned by our students. Reminder after reminder that I'm not supposed to be here, that I didn't actually get in based upon my merit. Black students, other students of color, and white students witness mistreatment of Black students without consequences. Sub-theme here was that our Black students witness mistreatment also of Black faculty and staff, particularly Black women. So students shared not only their personal experiences, but they also shared, I see my Black professor get talked to in this way. Or I see students be aggressive towards this particularly Black woman professor, and I think she's a great teacher, and I see them not treat white professors in the same manner. And the last theme that our students really commented on was the lack of Black and in general diverse faculty, staff, and students. So many experiences of being the only in different spaces, classes, student organizations, etc. So next I want to share just a couple examples of themes and posts to give you a sense of how things got categorized. So a couple themes, right? The racial profiling by police and others, and then when racism is reported, nothing happens. An example, I was in a Delbert Hall picking up a laptop for my campus job. I peeped an old white man peep me and continued to my destination. After the employees gave me the laptop, I left their office and was making my way out. I saw the white man come out from a corner nearby that only had the women's restroom, so I knew he was following me. I continued making my way to the door, and he stopped me and asked me, "Is that your laptop?" He identifies himself as a plainclothes police officer, and I identified myself as a student employee doing my job. I gave him my case ID, and he told me it proves I am who I am, but not that I didn't steal the laptop. I told him I can pull up proof on my phone, but he got impatient and had me show him to the office I got it from. He asked them if I was really a student employee and let me go once they verified I was. I put in a complaint and found that other Black people on campus have had problems with this same officer. Nothing happened to him. Right? So this is a really painful example of two themes: racial profiling by police, a plainclothes officer in this instance, and also that this student made a report and nothing happened. There was no follow-up, there was no consequence for being profiled. A couple more examples here. Themes of pervasive microaggressions and racism, and then that gendered racism again. I have never felt more alone and isolated than during the Yik Yak era. Students anonymously submitted posts to the app about whatever they wanted, and other students could give the post upvotes if they agreed and downvotes if they disagreed. Every single day, there was a racist post, every day. And people would upvote their racism anonymously. One that stuck with me was a post saying how ugly Black girls were, and it had over 50 upvotes and a ton of comments agreeing. I hated walking around a campus where so many people anonymously thought I was ugly just because of the color of my skin. Pervasive microaggressions and racism again, just to give you a couple more examples. On move-in day, my freshman year, one student asked me how many of my family members were in prison. That's also an endorsement of a stereotype, right? I was in a department show where I was tokenized as the only Black actor and faced many microaggressions from my white director telling me that I wasn't acting Black enough. I was in a meeting with admin and I had an idea of how we can solve an issue on campus. I was told it wasn't a realistic idea. Like 10 minutes later, a student who was a white male had a similar idea and basically restated what I had said. Then they all agreed with him. He received all the credit for this wonderful idea. I walked out of that meeting so discouraged. So as you can imagine, the mental health implications related to these posts are many. As well, all of them likely have ramifications for a student's general experience at Case Western Reserve, and certainly their academic performance as well. So just to review a couple things, a range of feelings, right? Students reported feeling not cared about, discouraged, unwelcome, and unsafe. There's a lot of anger, irritation, annoyance was mentioned, shame and embarrassment. If you can imagine, like, you're moving in and you're being asked if you have family members in prison. That student also made another post and really spoke to, I felt so ashamed that someone would think that of me, and that's the first way that they would greet me at my university. Also, many students talked about feeling very alone. There was a lack of trust from our Black students, and rightfully so, based upon their experiences on our campus. Isolation, loneliness, mental labor. So think about the extra mental labor that's involved in trying not to be perceived as a threat, trying to prove that you belong here, trying to prove in the classroom that you are smart, remembering that you need to wear case gear when you go out at night, or I should probably carry 2 IDs with me. All of this extra mental labor that our Black students spoke to. Exclusion, constantly misunderstood and misrepresented. Racial trauma is a really big implication. Racial trauma being that mental and emotional injury that's caused by encounters with racial bias and ethnic discrimination. Racism and hate crimes. The risk for racial trauma increases when a person experiences emotionally painful, sudden, and uncontrollable racist encounters. I want to let that sink in, so I'll say that one again. The risk for racial trauma increases when a person experiences emotionally painful, sudden, and uncontrollable racist encounters. All of the experiences in these posts from our Black students fit that, certainly raising their risk for racial trauma. And another mental health implication, there are certainly more, here's just a few. Our students were not seen for themselves. They were stereotyped frequently and often in a negative direction. So based upon the mental health implications from the post, I then proposed various interventions and action steps, some of which we've done already and some of which are still in progress. One of the things that we rolled out beginning late summer, and we've continued throughout the school year, is what we call BIPOC support space. So these are one-on-one mental health consultations that students can sign up for to meet with me. They are not counseling sessions, they're just consultations. So they don't have to be a client of our counseling center. I do not keep any notes. So there's no record that they've utilized this service. And they're brief, they're just 30 minutes. Students can register for them one time, and they actually register through our campus groups page, which is how all of our students register for different campus events. This one's private, so no one's going to know that they're registered. But again, there's no ties to the counseling center by utilizing this service. Students have signed up one time throughout this year. I've also had repeaters, right? So folks who may have been dealing with an acute situation and needed support. And so they signed up weekly, and I might have met with them for a month. Students who sign up for this, if they need more than a consultation, I'm also able to link them very easily to our counseling services so they don't have to call in or make an online appointment. We also expanded our identity-based counseling groups. Our Women of Color group is something that we had before, but changing the time that we offered it in the hopes that it would attract more students. We started a Black student support group, particularly because of the racial injustice that was happening last summer. So this was a new group that I ran. It was drop-in. It was another group that was something students could register for via campus groups. So again, they don't have to be a client. There is no record. That was open to in-state students as well as out-of-state during the pandemic. And it was a group where sometimes I had students drop in for one time. Sometimes students came back repeatedly. It ended up being a really, really powerful space. And also coincided with providing support after critical things happened. Like I remember the group happened to fall on the same day that the lack of guilty verdict for Breonna Taylor's murder occurred. And so having news come out and then having the group to be able to offer to students to be able to immediately process things that were happening. We also started a Students of Color group this past year as well. We increased our outreach and our virtual campus presence. So this frequently involved me going to all events that I possibly could, which this has actually been a benefit of the pandemic, is that my time can be more flexible. And so it's really easy for me to pop in virtually into different campus spaces, both with students, but also faculty and staff, so that they also are aware of, how they can refer students and what our services are as they're talking to students and seeing things happen in their classroom. We are an integrated health and counseling department, so we also made some changes on our health services side. One of those changes was really attending to race as a risk factor in our COVID-19 protocols. So as we're caring for students in relation to the pandemic, in relation to maybe a positive COVID test or to family members or exposure, how are we talking about race with them? Because that was a risk factor, certainly in death and hospitalization. Other things that we did was making this a dedicated role. So those who were here at the beginning of the presentation might recall that making dedicated support roles for students of color and their mental health in particular is one of the recommendations. At Case Western, we already had the multicultural specialist position. But what we did was to really review and update the position description and making intentional choices to promote it to the campus community. Now, let me be clear, that wasn't about promoting me as a person to the campus community, but really the position. And so one of these things just happened recently where we spotlighted the position in our daily campus newspaper. As a result of that, I've already been getting more outreach requests from faculty and staff who know that I exist in this position and are inviting me to come. So that's what I mean by promoting it. So it's not just we have this position, but do students, staff, and faculty know that it exists and that it can be used as a resource? We created an advisory group of faculty, staff, and student representatives that is all focused on the mental health of our students of color. So we're able to hear from the campus community. What are they seeing? From students themselves, what are they experiencing? What are the issues? What ideas do they have about ways that we can address it? This advisory group is larger than health and counseling services. This is really a campus effort that we are trying to spearhead to bring this conversation to the forefront. And we're getting great ideas as a part of this group. Needs assessment. So the Instagram was one part of that. We are doing other things. So I'll talk more about focus groups in a minute. We are planning to do the Healthy Mind survey this coming fall as well. Additional trainings for our health and counseling staff. So going back to the recommendations from the equity framework, you might recall that one of them is to actively train, recruit, and retain diverse, culturally competent staff. Well, it might take a while to recruit more diverse staff, right? That isn't something we can do overnight. That requires, honestly, at this point in time, more funding. What we can do immediately is to make sure that our staff are up to date in their training and their knowledge and in their practice of how they're working with different student populations. And so that's something that we've been able to do already. We've done a racial trauma training with our staff that we've done a part 1, part 2 will happen this summer. We've also done a training on microaggressions. We also, as a department, have formed a diversity committee. That diversity committee is looking at things like our hiring practices. How can we recruit and retain more diverse staff? Various staff trainings, discussions for staff, various events for students as well, different support spaces that are based upon identity. To give you an example, one of the things that we did in February actually was we did a common book reading as a staff department. So all kind of 50 to 55 of us read the book by Emmanuel Acho, Uncomfortable Conversations with a Black Man, and then we discussed it together in small groups. As another example, this coming Thursday for AAPI Heritage Month, we have all been asked to watch the Vincent Hu documentary, which is the story of Vincent Chin, who was brutally murdered in the 80s. We've all been asked to watch that documentary, and then we're going to be discussing it together and what are the parallels to what our Asian and Asian American students are experiencing now in regards to racism and hate crimes that are affecting their community. It's just a couple examples. We want to make sure that the learning for our staff continues to occur. A little bit more about focus groups in case anyone is thinking about running them on their campuses. This has taken a little bit more time because of the IRB process. If those of you who have done research and higher education know that that can sometimes move slowly. So we have submitted the IRB and are in the process of making some revisions in the hopes that it will, fingers crossed, be approved soon. So these may happen in summer or fall. We're planning to do 5 virtual focus groups, really splitting up our undergraduate students from our graduate and professional students. Those who may be less familiar with Case Western Reserve may not know that we actually have more graduate and professional students than undergraduate students, and they often feel really neglected and forgotten on our campus. And so we want to make sure that we have groups for our BIPOC undergraduate students and our graduate and professional students. We do have a law school and a medical school as well. Our recruitment plan is to really take advantage of all of the campus connections that we've been building over this year, right? So our our advisory group, student organizations, Greek Life, Office of Multicultural Affairs. We've already got listservs that we can post to. We also have an incentive, so we were able to get some funding. We are able to offer students a $20 gift card for their time. The focus groups will be 60 to 75 minutes in length. And we have our questions as well that we plan to analyze. So just to give you an example of some of the things we plan to ask our students is, what does mental health mean to them? How have their experiences as BIPOC students at CWRU impacted their mental health? Getting a gauge of recent events, socio-political events, for example, in their mental health, challenges that they've encountered, and accessing our services. What services would they like to see? And then just providing a space for them to share about mental health on campus at Case Western and how they feel like it's being regarded. So I want to pause here because I've been talking a lot, right? And I recognize that what works for Case Western Reserve may need to be adjusted for your specific campuses. Things to know about our students is our students are really vocal. They are politically active. They are socially conscious. They really are change agents, and that they speak up, they protest, they write letters, they want to be involved, they want their voice to be heard. And so one of the things that I've learned throughout doing different needs assessment strategies this year is that it doesn't take as much work as I would have anticipated to get students to meet with me. As an example, we did our equity symposium, which I mentioned earlier, in April, and we had student speakers do our closing. And so I reached out to a number of students. The challenge was getting them to read their emails, right? Because they're bombarded during this virtual age. But I heard from every single student who I reached out to, and every single one of them wanted to speak. I actually had to end up saying like, oh, I'm so sorry. I actually have all the spaces full. But that's kind of our case culture of, if you give students the opportunity to share their experience, they want to talk to anybody who's willing to listen to them. So that's kind of our campus. I would love to hear from a couple of you all about what approaches have you found helpful in assessing mental health on your campuses, and what considerations might be needed for your specific communities.
I had a question. I'm from Penn State Altoona, which is a pretty small campus in Pennsylvania. And so we only have about 3,400 students. And so our counseling staff is pretty small, not too many counselors. So we don't have like a multicultural specialist or anything like that. We also don't have, unfortunately, any counselors of color on our staff. And so I really loved the idea of like that safe space with the one-on-one consultations for students of color. But I'm curious your thoughts on like how that could even be possible, or whether it would be possible on a campus that doesn't have quite that many resources.
Yeah, absolutely. That's a really good question. I think that it is certainly still possible. Now, there are going to be some students who want to meet with a counselor who looks like them, identifies in the same way.
Absolutely.
And we just respect that, right? So even all students of color do not identify as Black who use that space. And so just acknowledging it. But the relationship building, I think, is still possible for everybody. So I think you could still offer something like this at your university, but I would encourage you to do some work first of like having that staff member go to different campus events. Do they have a relationship with your multicultural affairs office? Have they built trust with various communities of color? Just as an example, so that they have some kind of credit before and trust built before they offer it.
Absolutely. Thank you.
I just wanted to chime in. My name is Reinhild, and I work at Cleveland State University in the social work department. That I'm really intrigued by this idea of a BIPOC support space that isn't necessarily therapy. And so I'm always immediately trying to apply this to teaching, right? I'm going, what if we didn't have to, what if we did this before students need a support space? How do I create a support space for all of my students in the classroom? So that I'm always wondering, am I stereotyping in class when I'm assuming you have trauma because you're a student of color, right? Or calling you out too much in class, asking you questions about this. So I just am wondering about creating a supportive space in the classroom. I know that's kind of a little bit beyond. I just wanted to ponder that and maybe get some feedback from everyone who's here about being a supportive space in the classroom so that the mental health needs, that I don't amplify the needs.
Mm-hmm. Yeah, I think that's a great question. It's not off base at all. So one of the things that comes to mind for me that our faculty in the classroom can be doing is acknowledging what's happening in a larger society. So as example, I had a number of clients this past year who killings are happening in the news. The election is going on. Transgender rights are being challenged, and my professor is not acknowledging any of it. And I'm a student who identifies with those groups, and I'm scared, I am anxious, I am stressed, and it's business as usual. And really it's status quo. So we're here to learn and we're not paying attention to the issues that can be affecting our students. When a faculty member simply spends 5 to 10 minutes and opens up their class by acknowledging what's happening and that things are hard and inviting students to share, it has a huge impact. I've heard that from my clients time and time again, and it doesn't have to be a lot. I've had a student who shared that I had a professor who just acknowledged, we're still in a pandemic. And so even though things are opening, you might still be affected. That meant to the world to this student. Another example is I've heard a couple of faculty members in our law school here at Case have been opening class with a mindfulness meditation just to help center students from everything that's happening before they begin. I just heard from a student yesterday, like, that's been really cool throughout this year, and nobody else is doing that in my other classes. So I think really small ways that you can just acknowledge what's going on and how it could be impacting students and making yourself available to talk if they want to.
Thank you so much. I think this is like a great reminder for me as I'm starting to teach a summer class right now that's just starting to start saying, like, how can I make sure to all students that you are welcome and that I see you and not some picture of you, some image of you that I have. So thank you. Great reminder. Thanks.
Yeah.
So much has happened since the beginning of this school year. A lot of it has been with the help of people like you, Naomi, who have been giving these presentations. And I think I'm also at a school with little resources, and I am the only mental health counselor. We have 200 students in the whole school, and zero support for especially our Black students. And I found that last school year, had our especially Black female students were very open to coming and seeing me. But then when the shit hit the fan over the summer, they slowly just sort of vanished from signing up with appointments with me. And so it was this mad scramble of how do we find something, anything? And so for me, I found that any grant money that the school was getting or any grant that I could apply for, one was through Neomed, that it was funneled all directly into the support of just our Black students. And it really made all the difference in the world. And we have, our students are activists. And so something else that I learned was that they had, a lot of the females had started to see a counselor who was at the Art Academy a number of years ago doing her residency for her PhD, African-American woman who was awesome. And they all loved her. She's in private practice now. So they tracked her down and they're paying her out of pocket, as college students to see her when they could see me for free. Mm-hmm. So one thing I did just last week was I got in touch with her and said, we're going to figure out the money, but would you see our students next year and you can bill us and we'll foot the bill? Because it's just another situation where students of color were having to go above and beyond and around the existing system and paying for it while, you know, all these white kids are getting free counseling and they're not. So it's just like this other barrier that came up. But so I think it's, you know, when there's little and no money and just me to like really to admit my scope of services, and then just reach out anywhere to bring the help in. And I've learned about, you know, where to find this help through attending so many of these webinars and symposiums and stuff. So I do think for like the counselor at Penn, like there are ways to, you know, you just reach out, because we can't do it ourselves in a tiny department. And we are also requiring that our faculty and staff get training this summer for equity and inclusion. And we also are going to we had one student start a Black student union at our school for the first time. And we're going to start, you know, compensating students who run their own groups for their time, because it seems like, you know, there will be a student who's a particular leader and they just work overtime from their classes and all of their assignments for free when they are doing a huge service for the school. And so we're going to start compensating them as sort of work study students next year, which I think is also going to be great. I'm excited.
Yeah, that's great. Thanks, Casey, for sharing.
Hello. I'm sorry.
Oh, sorry. I know Haley's going to jump in here and say we have to wrap up. I just wanted to respond. I know that there have been questions in the chat around virtual engagement and how we got students to attend groups. It certainly has, I mean, it's picked up at times and then it's died down. One of the strategies has been to make sure that we're partnering with our Office of Multicultural Affairs, who is very connected to our students of color, is a trusted resource. And so everything that I offer gets put into their newsletter. And then we'll do some things together. So for example, with anti-Asian violence, like, right, I recognize I do not identify with that community. So how can I partner with them? How can I be an ally, but also respect that there are even spaces where I may not necessarily be desired. And so partnering with our campus community has been one of the ways that we've gotten that engagement from students, is not trying to do it by ourselves.
Great. All right. Thank you so much, Dr. Drakeford. So we are a little bit over time. That's all, folks. Thank you so much, Dr. Drakeford.